So we're really pleased to have today 4 experts. We're going to kick off by hearing from Professor David Harper. David's a Senior Consulting Fellow in the Global Health Programme at Chatham House, but he was the Chief Scientist and Director General for Health Improvement and Protection in the UK's Department of Health. And during his time there, he was closely involved in preparing for and leading the department's response to the 2009-10 influenza pandemic. He was also Special Advisor to the WHO in Geneva when the Middle East Respiratory Syndrome, MERS, and other coronavirus became a focus of international attention, and when influenza A was first reported to the WHO by China in 2013. So David's going to open the session by giving a bit of background on coronaviruses and also his overview of the situation as it stands globally and in the UK. We're then going to pass to Professor Tim Benton, Director of Emerging Risks and of the Energy, Environment and Resources Programme at Chatham House. He's going to talk a bit about how coronavirus, the current pandemic, relates to environmental breakdown and the climate emergency and what it means for the future. And then we're going to hear briefly from Dr. Beyza, Unal and Dr. Robin Niblett. So Beyza is a Senior Research Fellow in the International Security Programme and works, among other things, on urban resilience and preparedness for chemical, biological, radiological and nuclear threats. And then Robin is going to speak briefly to the broader implications for the global economy and international affairs. We may use some of the content from this publicly, so you should treat this session as on the record. So I'm going to hand straight over to David.
Hi everybody, and thanks very much, Laura. It's a great pleasure to be, I think, a guinea pig for this, the new way of working. Sadly, the conditions that we're facing are pretty drastic conditions, but at least we'll have a chance to say a few words. And I'm going to kick off quite briefly to leave other people to speak, and then to hopefully leave quite a lot of time for the questions and answers. I've got a few slides, so if I can get this to work. So I'll just rattle through these. Coronaviruses. I thought I'd start by just saying a little bit about what coronaviruses are before we get into the current situation. They've been known, coronaviruses, as a group of viruses probably for 50 or 60 years, since the late 1960s. Known to infect animals and people, and this is a very important feature because many of the viruses and some bacteria that we're concerned about in the sense of pandemics, epidemic spread, are what we call zoonotic infections, and they're infections that arise in animals and spread to humans. And I think that Tim will probably say a little bit more about this in a moment or two, and the impacts of climate change. But if you're able to see the slide, and I guess that some people will be phoning in, so maybe the slides will be made available a little later. But for those of you who can see the slides, the picture that's there is the sort of classic representation now of coronavirus, and you can see the name comes from the crown-like arrangement of the proteins on the surface of the virus particle. The coronaviruses that we know about, 4 of them are known to cause symptoms very much like the common cold. We've all heard about SARS and MERS, Middle Eastern Respiratory Syndrome virus. Now we've got COVID-19, the disease that's caused by SARS-CoV-2, as the virus itself is called. Why are we concerned about it? Well, essentially, it's a new virus. There is no immunity in the population. It's a naive human population. And there is a huge amount that we are trying to find out as quickly as possible about the virus, how it's transmitted, who it affects most, how long does it survive, is there residual immunity once you're infected? all the sorts of things that will help us, both in an epidemiological sense, but also in terms of trying to manage the spread of the virus and deal with the spread of the virus. As you all know, the illness was first identified very recently, as the end of December 2019, and it was reported to the World Health Organization under the commitment under the international health regulations. And I should say the IHR that people talk about, these are just one of two pieces of international legislation in the public health area. So it's very important. The other is to do with tobacco control. But China reported the disease as it was, the observation that there were some cases on December the 31st, 2019. The coronavirus itself was identified on the 7th of January this year, as I say, very recently. We all know the symptoms, it's cough, fever, shortness of breath, not always a shortness of breath. In many, many people, it's a very mild illness, and we think there are a huge number of asymptomatic people around, so people that aren't expressing any symptoms at all. And I should say that the cough that you get with COVID-19 is a particular type of cough. It's a dry cough. It's not the where you have a lot of phlegm. Sounds very nasty for those of you who are having your lunch at the moment, but it's a dry cough. And this is what we're looking for is a new cough, and it's on a continuous basis. We know that the elderly and those with comorbidities are most at risk. Comorbidities, anything from chronic obstructive pulmonary disease to heart disease, diabetes. And the way that people are now, and the authorities in the UK are describing those people who are at risk, people that are, have the comorbidities, it's really people that are offered the seasonal flu vaccine that should be considering themselves to be in that group of having the comorbidities. A bit of an oversimplification, but it's a good working definition. Huge uncertainty, as I said. We'll pass on. The situation globally, you can see we're now, as of today, over 200,000 cases. These are reported cases. Some of them, many of them confirmed by laboratory testing, but not all of them. Over 8,000 deaths, sadly, and around 160 countries, areas or territories that are now reporting cases. In the UK, we're approaching 2,000 cases that are reported. Many, many more we would expect to be there in the community, and there are figures of tens of thousands of people that might be infected currently with the coronavirus, and 71 deaths. The figures, 1,950, 71 deaths are from reported by the Department of Health yesterday, but they're very consistent with the figures that are on the internet. WHO recommendations right from the outset, and these are recommendations that you would be well advised to take through any winter, and if you're trying to reduce the risk from influenza and any respiratory borne disease, it's about washing your hands frequently, respiratory etiquette, coughing into a tissue, disposing of it sensibly, and avoiding people who are exhibiting symptoms, so those people who are sick. What WHO also recommended was that there should be an intensive period of trying to contain the disease. And this is what we've been hearing a lot about, moving to different phases and different countries doing things at different times. But the WHO recommendation is very clearly that there should be active case finding, identify as early as possible people who are infected, trace the people that they've been in touch with, so-called contact tracing, and then isolate people as necessary, supervised isolation ideally, but then isolation at home, self-isolation if that's what is more appropriate, and patient treatment and patient management. The real-time information, many of you, I'm sure, if you've been interested to follow this, will have seen this dashboard. There are a number of them that are out there. This is the one that is being very commonly used. I use it on a daily basis, many times a day. It's being used by many of the broadcasters. And you can see these are the figures that I quoted from earlier this morning. You have a list of all of the countries and the regions and the numbers of cases. You then have a similar situation on the right-hand side of the dashboard with numbers of deaths. And then you have people recovered. And this figure down at the bottom, you can go in and interrogate it further, but you can see very clearly the orange line, I hope you can see clearly, is the number of cases reported in China. And you can see the effect of the actions that they've taken there. You can see also that the yellow line are the number of cases outside China, and they have overtaken the number of cases within China, and the green line are the number of people who are recovering as far as reports are concerned. UK measures that were announced this week on Monday really come under three headings: social distancing, and we can say more about that if you would like to in the question session. So it essentially built up of four components: reducing non-essential contact, reducing unnecessary travel, home working where possible, and then don't visit those places where you're likely to have social contact, like pubs, restaurants, theatres, and the like. Household isolation, this was a change on Monday from what had been recommended just the previous week, which was for symptomatic people to stay at home, self-isolate for 7 days. And the reasoning for this is the period of infectivity, the period that it takes to develop symptoms, and then the period to reduce infectivity. But on Monday, it was announced that people should, in a household, the whole household where there is an infected person, should stay at home, and that should be for 14 days. And again, there are reasons for that in terms of exposure that I think are fairly logical. You would see that, so I won't say any more about it. This third point here, the most vulnerable being shielded from social contact for 12 weeks, this is one that's causing a great deal of consternation. And these are huge measures to be taken. I've not experienced anything like it in my career, my lifetime, and in peacetime, essentially. These are the sorts of things that might have been appropriate back in the Spanish flu pandemic in the 1918, 1919 timing, but this is really unprecedented in recent times. Then if we're successful, if the UK is successful, if the global community is successful, this shows, I hope, fairly clearly why these measures are being recommended. The big peak is illustrating what would happen if no measures were taken. The idea, the rationale is to try and flatten this peak and to move it later so that the capacity of the NHS, which I'm bound to say is one of the best services in the world, and it's recognised by independent assessors as being just that. If the NHS is going to be challenged, and it will be, it already is being, these sorts of measures are absolutely vital so that it's not overwhelmed. And if we're successful, if the community is successful in following the advice, following the recommendations, seeing how really serious this is, on a voluntary basis at the moment, but there are powers that allow more legislative action to be taken, more enforcement action. But the idea is to push this peak further into the summer period and to flatten it out. And hopefully that's what we will see. Coming on to the last slide, what are we looking forward to? What's the future hold? Well, I just jotted down a few things here. The uncertainty is huge. It remains huge. That's uncertainty not just about the disease, that the research should, as we go, try to plug some of those gaps. But we can't predict from the models what is actually going to happen. The models are only as good as the information that's put into them. And whilst, again, we have many of the best modelers in the world who are working around the clock to help the policy makers and the decision makers, the risk managers do their jobs, They are just models, very refined models, but nevertheless, they will only say what a range of possible scenarios might be, and most likely scenarios, and hopefully model the impact of some of these interventions that I've mentioned. Research is not just about the disease, it is very much about trying to find therapeutics, trying to find vaccines. We don't have those at the moment, and this is why we are so worried about the spread of this particular virus. Global national action, inevitably, this will happen. It will continue to happen. Just yesterday, we heard the Foreign Secretary announce more measures within the UK, but the disruption to travel, the lockdowns, the border closures, these are all things that are likely to continue for the foreseeable future in different countries at different times. I've alluded to the health, the social and economic impact, and I won't say any more about that. The last one, ongoing challenges, many challenges, but I've just highlighted here one that I feel particularly strongly about: communication. And I've gone on record as saying that it is one of the huge challenges. We can always do better. We're in a different position, with a different situation with the current outbreaks and pandemic that we were even as recently as 2009, 2010. Social media is used a lot more widely. It was being used then, but we now have a vast amount of misinformation, misleading information in the public health communities, and we all need to deal with that and try and find trusted sources of information. And importantly, the people that are those trusted sources of information need to get out there. It's happening increasingly, and we'll see the impact of that hopefully in the time to come. But people speculate. If they don't hear something, they maybe fear the worst. It's a very tricky situation not to be overexposed in terms of communication and measures that are being taken, because people can get very weary. But we feel, and a lot of evidence is there to say, that people that think they should be hearing something and aren't hearing something can be far more anxious than somebody standing up in a trusted position just to say, I'm here, there's not a lot to report, but this is the situation. And then recovery, and hopefully we'll be heading towards recovery and getting back to what people describe as business as usual. It's something that we can look forward to, but I think it's going to be months before we're in a position to be able to begin to see that sort of recovery period. And I will stop there. Thank you all very much indeed. And I think, Laura, I'm handing over to Tim, if I may.
Hello, everybody. I'm not going to talk for very long, but I do just want to say a few things from my background as a evolutionary and population biologist. I think we have tended to medicalize events such as this, rather than from a strategic perspective see them as part of a pattern, and to the point where towards the middle and end of last century, I think there was a kind of mindset that actually medical technology is so great that infectious diseases are largely something that we will do with in due course and we will get rid of them. But since that time, what you can see on an almost yearly basis and even on a monthly basis now, we are being challenged with new diseases. Just off the top of my head, HIV, Ebola, SARS, MERS, swine flu, avian flu, Lyme disease, Zika, dengue, West Nile virus, etc., are all things that have appeared over the last 20 or 40 years or so. And as David mentioned earlier, the thing that we have kind of forgotten is that pathogens, the viruses and bacteria that create these diseases, they have effectively evolved to infect susceptible organisms, whether plants with plant diseases or animals with animal diseases. And from an evolutionary perspective, they're always looking out for fresh hosts to infect. And there are very many more pathogens out there than we care to admit to ourselves. Probably only 10% of all pathogens have been described far. So 80 to 90% of all potential disease-forming organisms have not yet been described. And then on top of that, of course, what we're doing with both environmental change and climate change is impacting the way that animals, the vectors of diseases like mosquitoes and ticks and so on, reservoirs of disease, which are animals that might have diseases inside them, but they are not immunologically challenged by them, and humans. We're mixing up the way all of those interact. And from an environmental perspective, we're doing that because we are changing the pattern of habitat and we're concentrating more animals in fewer places. With climate change, we are creating the need for animals to live in new spaces. And as they live in new spaces, a host animal, a reservoir animal might move at a different pace from animals that eat it, and we might get a kind of a new way of animals intermixing. And then, of course, within cities, we're increasingly urbanizing the populations, and we think that urban green space is a good thing. But within urban green space, we often force large numbers of potential vectors, large numbers of potential reservoirs to live together. So rats, foxes, bats, etc., often live in green space. And at the same time, we have a whole host of people who are often vulnerable, poorly paid, and living in intensely crowded conditions, which interact frequently in those urban green spaces with the potential reservoirs of disease. So what we have is a situation where actually we're increasing the risk of diseases jumping from animals to humans. So if you just think about the list of diseases, emerging diseases that I've mentioned earlier, HIV, Zika, Ebola, dengue come from primates. Bats have given us SARS and perhaps COVID. Camelids and bats, so from bats to camels, gives us MERS. Rats has given us hantaviruses. Birds have given us avian flu and West Nile virus and so on. And all of these are situations where we should be expecting new diseases to emerge with increasing frequency. We will not be able to medicalize all of these diseases, as we can see with this particular one. And we shouldn't expect these to be something to do with our history, Black Death, plague, etc., things of the past, but we should recognize that actually the way that we are changing the world and the way that we as humans are interacting with the world is perhaps making these more likely. So the question is not about how do we deal with COVID, it's much more about how do we build urban, resilient societies that can cope with the sort of interruptions to human health systems, or as we'll probably find, human food distribution systems. How do we build the resilience within our societies to cope with these threats, of which emerging diseases are just one, and perhaps more frequent than we would imagine from the past. With that, I'll pass back to Laura.
Thanks, and I'll pass straight to Beyza.
Okay, thank you very much. So I'm the first responder in this scene. I'm going to take a few points that what David and Tim mentioned. David pointed out the intensive period that we are going to get into trying to contain the disease. And Tim's last point on urbanization, in a way, is a catalyst to new diseases. And we need to be thinking about how can we build urban resilient societies. I want to take on those 2 points because we need to think in an innovative way. And at Chatham House, David Harper, myself, and Ben Wakefield actually run a 2-year project, almost a 2-year project on urban resilience against urban resilience against biological threats. We specifically looked at African cities, but what coronavirus is actually showing, we need to be resilient in each city. That is, I think, the innovative way of thinking. When responding to pandemics, we generally think about the national strategies and national approaches or the global approaches. And at the moment, even the global approach is missing. I think Robin is going to talk about that. But we need to be also thinking about the local approaches and kind of thinking about the community resilience in responding to pandemics and the role of cities containing the pandemic. And strengthening the city level frameworks in that regard is extremely important as putting up national policies or international and global strategies. We need to realize that the pandemic starts and spreads from local to global. And urban environments such as cities are actually fundamental in containing the pandemic. Only a few days ago, for instance, Boris Johnson indicated that London is a few weeks ahead of the rest of the country. We are seeing the similarities with Paris, with New York, and all around the world, actually. And in that regard, I would like to stress that the community resilience is key to reduce the transmission rate in cities. So what involves community resilience? First of all, each city is different in health capacity. Thus, it's extremely important to create city-level action plans and frameworks if that city does not have it. London, for instance, has a city-level action plan for health resilience. Now, the question is whether that you can actually implement that action plan or not in the case of a pandemic. And I think that's what we are facing today. During the Ebola outbreak in Nigeria, what we found out throughout our research is that there were community level informants that played a significant role in Lagos. Community level informants are people that have basic disease surveillance training, who could assess local situation and then send the data to the surveillance notification officers at the local wards or areas, who then pass that information to national units. And I think that should be kind of a way forward, at least for some cities who could establish such frameworks. And also community resilience means creating strong leaderships, but at the community level, not only at the national level. It requires communication channels, which David mentioned in his speech, across all stakeholders, including with local health groups. And I would also say that community adaptation to the new normal is really important for the local and national economy. During the Ebola outbreak, again, our research showed that some cities were more resilient and they actually adapted and created innovative approaches. For instance, we heard about motorcycles being used as ambulances, not to carry patients, but to actually have the health sector, the doctors, to actually be able to come to the houses really easily, much easily, where the transportation was blocked in Africa. So each city should be able to think of innovative approaches in adapting the new normal. And also each society has poor and vulnerable community groups. So health risk increases in these groups, thus community-based risk assessments needs to be done at the city level. Two more points and then I'm going to stop. The sixth point is community resilience also involves home care measures for the ill and establishing isolation practices when sharing homes. And that is actually about community resilience. And during the outbreak in Ebola outbreak, these practices were established later at some stage, limiting the number of carers for the person, for instance, or isolating that person from the other family members and so on. Lastly, voluntary community organizations can actually offer some skills while coping with the stress or anxiety, and cities can start thinking about what type of approach they can put for new community organizations to establish such things. They can also help people to cope with grief as well. In conclusion, I think communities are central to the emergency planning, recovery and response, and we shouldn't forget about the importance of cities and local communities.
Thanks, Beyza. Straight over to Robin for 3 minutes before we go to questions.
Thanks very much, Laura, and great to see a big turnout here for our first effort to do a kind of mass group. I see 140 participants, 141, so that's got to be a good sign, although obviously pretty dramatic context in which to be doing this. I just wanted to make 4 points, I suppose, from where I'm looking at the crisis, given that I don't approach it from the angle that a number of our other Chatham House colleagues have done. we are, number one, in a period of huge uncertainty as to the economic impact of the crisis. Numbers are out there of a 15 to 20% contraction in Chinese GDP over the first 3 months of the year. If that were replicated across the world, and each economy kind of went through a cycle of losing, certainly in developed economies, that kind of a level of economic growth, that would be extremely serious. But if it turned at the end of 3 months or 4 months and started to ease off, it would be manageable. What we do not know, and obviously we do not know, and we saw that very clearly from David's presentation, and I see some of the questions that will be posed to David, is will we be over in 3 months, or if there's a risk that there's no vaccine found, that people can be infected twice, that it somehow tips itself into the new flu year of next year. If you have a 1 year hiatus in global economic growth and a 15 to 20% drop in GDP that covers a whole 12-month or more period, we're into a completely different area of economic crisis management than we are today. So the first thing I want to say is it is so uncertain as to where we're going. We just need to look at all of the eventualities, but we need to think about a potential risk of a global decline of 15 to 20% of GDP, and that would be, dramatic. Second point, when are we doing this? We're doing this at a moment that is not optimal. There's no good moment for a crisis of this sort. But if you look at China entering, as it was even 6 months ago, an important slowdown in its growth as it moves to a new form of economic activity, that is a pretty dramatic timing for it to also be taking on the crisis of the coronavirus challenge. European growth was already declining and stressed. Brexit was the thing that Britain is meant to be able to handle because the rest of the world would be smooth. As we've seen with the collapse in the value of the pound below 120 to the dollar, down at 119, I think currently, you can see that Britain, as a country that people are wondering whether it is able to manage multiple risks, is taking some of the hit. And I would remind everyone we've gone into this crisis with very high global debt levels. So is everyone stepping up saying, we'll do whatever it takes? But the banks might be a little bit more resilient than they were before, but the government debt across the world, from China to Europe, including the United States, is very high. The third point, I suppose, is the response. I won't go into too much, simply to say that I would say governments are scrambling. We do not have the 2008 moment of an intelligent, coordinated, cross-government response. Yes, G7 have made some statements. G20 finance ministers have made some statements. There's been some central bank coordinated action. But the bottom line is we have not seen a single statement by key government leaders, whether through the UN Security Council or at the G20 level, saying, together, we will handle this. Jim O'Neill, Creon Butler, and I put out a note about this that was covered by the FT and others earlier this week. We are really missing that moment of joint action. And it's not just in the European Union. It is not just transatlantically where there's a lot of tension. It's also existing at this broader global level. So to finish up, what do we have to worry about and what are we doing? I think there's an internal and an external element. Internally, we've got to realize we're entering a crisis of a sort that we've never experienced before. We must make sure we avoid any deeper political and economic splits within our individual countries, because we are at a moment of great nationalism. So we need to be, as governments, I would say, and societies, demonstrating a level of focus on national protection, because at the moment I think people aren't really believing much of the collective action at a regional level. It really is a case of each government having to demonstrate it can manage the problem internally. We also have to worry, I would argue, a little bit at the moment about neighborhood regions that have not been hit. What happens if Egypt gets an outbreak or Libya? The neighborhood around the European Union, for example, could be unbelievably stressed. And are we thinking about potential spillovers? And the last point I would say is thinking, and this is something for Chatham House to be thinking about, will we ever go back to a normal? People talk about V-shaped curves, and we'll be back where we could be in 3 months or 6 months or 12 months. But it may be that the decoupling that was happening before between the US and China, the push for more carbon resilient and less carbon intensive production, now with the mistrust of global supply chains from the coronavirus, together, this may mean that globalization never goes back to what it was. And if it doesn't, what are the growth models? What are the global governance models that we need to think about for the future? And I think it's something Chatham House needs to be putting itself right front and center on right now. Thank you.
Thanks, everyone. And thanks for the questions that have come in so far. There's three kind of areas that are being repeatedly noted in the questions. So I'll try and group them. I think there's a big question around timelines. So speaking to what all of you have said, what is the likely scenario? I guess a question for David in terms of how long this will last. We've heard differing timelines mentioned. The Imperial report talks about potentially 18 months. How long do you think this will go on? But also where are the decision points? When will we know if we've hit the peak? When will we know how to start moving back into business as usual? But a big question as well around what will business as usual be? Do we want to revert back? What are the implications for how we work and how we engage more generally? And then another big set of questions, I think, around testing in UK policy. So why is it that the UK policy seems to have diverged significantly, not just from countries like South Korea, but from the rest of Europe? And what does that mean for options going forward? How quickly can we ramp up testing? How much do we know actually about the scale of it in the UK? So I'll start with those. So if we go to David first, and then others, if you just wave when you want to jump in.
Yeah, thanks, Laura. So a huge amount wrapped up in those questions, very good questions. How long will things go on? Impossible to predict, absolutely impossible. From the idealized version, if you like, of the impact of measures that are being introduced. And I should say that measures are being introduced in a stepwise fashion on the basis of the science, the evidence, the modeling. There are a lot of considerations that the risk managers, the politicians, the people sitting around the COBRA table need to take into account. Robin's talked about the economy, many different impacts and factors that are relevant, but the people that are doing the modeling and the public health people, the scientists, are meant to focus on those key issues in terms of their assessments. But we are finding out more and more about this virus and more about the disease every day. And that will help people make more robust assessments of where things might go. But it will take us probably a matter of weeks, 2 to 3 weeks, the experts are saying, to see what the impact of the measures that were introduced earlier this week might be. If people are sensible and follow the recommendations and the advice, then we might well see that flattening. That's the objective after all. But if people choose to disregard, and a lot of efforts going into the social sciences, anthropology, social psychology, to be able to try and help the government, the decision makers, make decisions that are more likely to result in the outcome that is being sought. That's a bit of a clumsy way of saying what I hope you realize. People's behavior is unpredictable. We've seen a lot of things like panic buying. On the other hand, we're seeing lots of neighborhood groups that are getting together to try and help the elderly and the vulnerable. And so there are a whole raft of different measures. I can't really predict. I can't say that this will be finished in 6 months or 12 months. People that are saying could be 18 months, from a personal point of view, that feels like it's beyond a reasonable time period. So the more people that are getting infected, and this links with one of the other questions or a couple of the other questions that have been asked, so I'll cover that now if I might. People are talking about immunity and whether people are protected after they've had the disease. And we don't know is the answer. We're looking at things like SARS and MERS and other infectious diseases, and we wouldn't be surprised to see protection. It would be more of a surprise if people were infected and weren't protected. But the fact of the matter is, at the moment, we don't know how much immunity there will be and how long it might last. It might, if it's there, last for months. It might last for years. Some people are saying even longer than that, but lifetime immunity, probably unlikely. But these are questions that are being investigated, they're being asked, but there needs to be quite a lot more done to understand that. But if people are immune to an extent after they've been infected, then there should be a development of what people were criticized for using the term herd immunity, but I'll use it, where enough people become immune that it helps in terms of reducing the overarching risk, in this case for the UK population, because people are less likely to come into contact with those people that are infected. So all of these things can play into the to answering the question that was asked, how long is it going to go on for? Simple answer, I don't know.
Tim.
Thank you, Laura. I want to address the question about do we want to go back to where we were? And I think obviously the answer is no. You know, from a long-term sustainability perspective, we have become pretty locked into consumptive-based lifestyle, consumptive-based economies measured by GDP growth in ways that in the long term are really unsustainable, driving climate change. And as we go through the century, the sorts of shocks to the system that we're experiencing now, whether from climate change or the impacts of climate change on the way that animals move around the planet or pests move around the planet, are going to become more common and more frequent. So one of the interesting aspects is that our system is pretty locked in to business as usual. And events like these are very rare, very precious windows of opportunity in which our responses can actually shove the system in a new direction and help build momentum for creating what Beyza and I were talking about, more resilient societies, more sustainable societies, less consumptive societies, perhaps societies where there is well-being more at the heart than consumption growth and so on. So I think, you know, as Robin mentioned in his comments, we've got a lot of thinking to do within Chatham House about where are the opportunities not to do a V-shaped recovery and quickly but get back to business as usual, but how can we nudge the system or kick the system into something which is better for the long term, better for people all around the world, not just better for economic growth. Over.
Just, David, I'm sure you've seen a number of questions around what's the end game here? What do you see as, from a public health perspective, what are we working towards? Are we working towards a vaccine, or, you know, what do you see as the goal, I guess, the achievement of which will signal a shift in the policy so far? But also just go back to the question of testing in UK policy. People asking, has the UK done the right thing? And how easy will it be to begin testing now so that we know when those peaks are occurring?
Okay, thanks, Laura. And I didn't pick up the testing point earlier, which I will do in a second or two. Just to say very quickly, I ill-advisedly used the soundbite business as usual. That is being used by a number of commentators, and it means a whole lot of different things to different people. So business as usual in some contexts is people being able to go to the pub again, people being able to go to the theatre and restaurant, that sort of social business as usual. I don't think anybody realistically and seriously would like to see us going back to a position that we came from, these dreadful situations often do create those moments of opportunity to shift the trajectory in all sorts of different ways. So I apologize for maybe rather flippantly using the words business as usual. I'm sure you all appreciate that. Testing. It's a big challenge. The capacity for testing in all countries is limited. In the UK, it's better than many. The UK government and the experts, the Public Health England experts, have been working hard with the NHS to increase the capacity, and you will hear in the media about ramping that up. It's already been ramped up and tests have been rolled out. The holy grail, if you like, is to have a test, two things, one that can be used near to the patient. So if it's used out in the community, that's a much easier way of doing testing. At the moment, the tests are constrained and restricted by being done by looking for the virus itself or the nucleic acid from the virus itself in laboratories. That's a very specialized testing regime. But the other point is, if we can have a serological test, then we can actually find out, so it's a blood test or a saliva test, where that will show previous exposure to the virus, and we will be able to get a much better handle epidemiologically on how the epidemic has spread, where it is, and then to be able to project as to where it might go. So the UK is ramping up the testing. There will be testing in the community through what is called the GP Sentinel scheme, and that's a sort of a subset of what is done, for example, during a normal winter flu season. So there are lots of things that are planned, and it is different in every country, but the objective is to increase the testing so that we get a better handle. Vaccine and therapeutics, one of the questions was about repurposing or looking at therapeutics that are actually out there already, and that's exactly what's happening. Some are showing some potential. There is one that people are talking about is an anti-HIV, an antiretroviral drug that appears at this early stage to have some impact. And there are lots of things that you might see on the internet that people are proposing, sort of almost herbal remedies for some of these things. But the fact of the matter is we don't have anything yet. The global community, not just the UK and Europe, are working very hard to get therapeutics. Vaccines, it will be a long job. The work is going very well. The research side of it was kicked off almost as soon as the gene sequence for the virus was published and released by China. And that was very early, which is great news. And that helps the situation markedly. But that's the very early part. So the research part is going quite well, as I understand it. But we're just moving through animal models into some of the candidate vaccines are going into human trials already. But those are assessing safety. That's a priority. Then they need to be tested to see if they work and have a benefit. And once you've done all of that, which takes a long time, but it is being short-circuited and truncated as far as possible, there's the licensing, and then importantly, the manufacturing, and to get enough vaccine in the volumes that are necessary to be able to make a material effect. This is why people are projecting to a year, for example, or even longer. But it is much shorter now with all of the energy in the system than it would be otherwise. I'll leave it there. Thank you.
Thanks. Robin.
I was just going to come in on a couple of the points I've seen come in on the questions, and maybe this thing about business as usual and what it means for Chatham House. But on the question that came up about government response, in particular European government response, and the lack of coordination, you know, the predictable thing to say would be it's always like this. The European governments tend to scramble internally first, especially on issues that impinge on national security, and a virus, a pandemic, an epidemic of this sort definitely moves into the security realm. So as we see it from areas as diverse as energy security, where Germany you know, often ignores what other countries worry about, when we think about the response to the migration and refugee crisis of 2015 and the way governments each looked after themselves. We had been here before, so I just don't, let's not over, egg this particular one, but given the unpredictability and the uncertainty around this crisis, I'm not going to underestimate the damage that's been done, and in particular, I think to Christine Lagarde and the European Central Bank are going to have to do some rowing back to regain confidence for the Italian government, given, I think, some unnecessary statements about not being there to narrow bond spreads when she made it. I think the big question will be, as the governments move into the heavy-duty lending and fiscal stimulus packages, given that the monetary policy is not as capable of making a difference as it might have been a while ago. Central bank rates are already so low, including in Europe. There's very little left for them to do. As we've seen, the market has not responded well to the coordinated rate cuts by the ECB and the Federal Reserve and the Bank of England and others. What will matter is how they use this thing called the European Stability Mechanism, the 500 billion war chest, which can be used to leverage a lot more money, and which could be applied to multiple EU countries rather than just being applied to the one or two that are in particular crisis. And you would not necessarily then have to use the same limitations that have been used before about the size of your debt and so on. So they could be included in that. So I think the EU is going to go through a flow, the usual everyone for themselves, and then a bit of a move towards better coordination. And I don't expect, I'm not too worried yet that the EU is just going to sort of implode or disintegrate at this moment. I think they'll go through their usual curve. There's a lot more to say about business models and for Chatham House. What I would say is a bit to Tim's comment earlier, that I was very conscious, I think as many of you are, that we've been needing to rethink our business model a bit for the last year, if not certainly 6 months, both in terms of the way people work, wanting to be able to work more flexibly, remotely, managing their time in different ways that technology would allow. And we were starting to roll that out with the greater provision of work laptops and all sorts of other initiatives that are being undertaken by Lisa, Mike, and the Digital Committee. I was very conscious as well that we need to think very much about our own carbon footprint if we are an institution that's talking about this being one of the principal challenges to the world for the next 10, 15, 50, 100 years. And therefore thinking about how we maybe adapt our business model in terms of how we run projects, meetings, rather than being as much about convening people from all over the world. We're now going to be forced to do what we had to do in any case. So I don't want to go fully back to the business model that we had before for Chatham House, never mind the world. And we maybe would be wise not to, because to David Harper's comment and some of the questions, if we are more vulnerable to return outbreaks of this sort at any given moment, we need to be able to flip between physical and non-physical meeting. We need to be able to give the flexibility and the capacity for people to do it. As we move more into communicating our outputs through the collab and the website and so on in more interactive and digital ways, then the projects themselves should also be more interactive and digital rather than being heavily meeting weighted as the way they've been before. I don't want to say that we stop flying around the world, because there are times when Chatham House colleagues going to parts of the world, sharing their ideas, using our incredible convening capacity in ways that maybe others can't, we're not going to want to give that up, and people will want it as part of our public service. But I don't believe we should be trying to return to business as usual. This is an accelerator for the kind of change we wanted to do in any case. And we had a very good SMT meeting for an hour and a half yesterday afternoon, which if I've got time, I'll be writing up with some colleagues this afternoon and sharing with Chatham House colleagues so you can see some of our initial thinking on this front.
Thanks, Robin. We're almost out of time, but I think most of the panelists are happy to continue for another 10 minutes to answer more of the questions, but do feel free to leave, panelists, if you need to. Beyza, if you're all right to stay, there's a question for you about the extent to which limited local authority, local government budgets are impacting on the response. And I guess that's also a question at national level. Someone else asked, is funding one of the reasons why the UK scaled back testing, and what do the budgets mean going forward? Beyza, over to you.
Thanks, Laura. So that question, I think it's not particular to UK. The US was having the same issues in terms of budget cuts to the local governments. And we have seen actually the same kind of grief in a way in African cities as well. When Ebola hit, they were saying that the governments did not put too much money to the local bodies to counter the threat. And we need to realize that there are other ways of raising money, but depends on, of course, the country and the strategy of the country and how they are structured. Private sector actually has an important role in putting up some funds to cities and to the mayor's office, to local bodies, in order to cope with and respond to pandemics. And this is an area that David and I have been working on for the last 2 years, and there should be a way forward with the private sector. Also, in some cities, the city themselves are actually also raising money, so they do not, they should not be able to completely require the national funds, and there should be some contingency money that could be allocated for emergency situations, not only for health reasons, but also for any type of emergency situations. I think going forward, there are a lot of lessons learned for cities. Of course, the government funding is extremely important, but there should be also other ways, innovative ways that we need to be thinking forward in the years ahead.
Thanks, Beyza. Another question that's come up, which I'm going to abuse my privilege as moderator to boost up, is one around what this crisis has told us about inequality and how we value different types of work. So not a specific question, but do any of the panelists have any reflections on how that's played out, and whether we might see shifts in policy or public opinion going forward?
I think, oh, Robin, go ahead.
Well, I was just going. I heard it was quiet, so I'll let Beyza come in very quickly. I suppose the simple answer is I don't know. I mean, I think that if we move to a world in which that sort of just-in-time, slightly Darwinian form of globalization is called much more into question, and there is a much greater awareness of the need for community, social, and national resilience, then the net effect would be, perhaps an additional spur to a focus on the inequality question. And the very fact that universal basic income is back on the agenda as part of the response, the fact that we are seeing the role of government yet again being absolutely central. And it's ironic, obviously, that in the United Kingdom, we have a Conservative government now in power that is presiding over some of the most interventionist and sort of Keynesian activity that's been seen by governments for a while. I do feel that something's different. I'm not sure we're going to answer all of the inequality questions, and there may be new types of inequality that emerge through this process. But I do feel this is an additional push in that direction of waking up society to community responsibility, the role of government, and a less Darwinian global kind of approach to those who can make it, and those who can't, they've got to try and keep up.
Thanks, Robin. David, there are a couple more questions around the nature of the disease. So questions around whether we know what potential mutations might look like for the better or the worse. Question from Patricia on whether we've seen other infectious diseases that don't seem to be affecting children as greatly, and Patricia's talked to a gender difference as well. And then also, a more standard question, can you be infectious without being symptomatic? I think indicates somewhat of a lack of clarity and advice there. Tim and David, I guess. Robin, you're on mute if you're trying to speak.
If I can just dive in and then David to tackle some of the greater things. Certainly from an evolutionary biological perspective, what you normally expect with new diseases is that they become less virulent over time. But one of the interesting things I think about our containment strategy is the extent to which we are creating an evolutionary selection pressure to make asymptomatic transmission more valuable from the virus's perspective. So I know one or two colleagues are starting to track transmission rates, you know, because if we effectively say, if you've got any symptoms at all, if you're young, you lock yourself away, then of course the virus would benefit if it manages to transmit itself before that happens. So you might expect the evolution of asymptomatic transmission, which of course then really does play a dirty game when it comes to thinking about how we manage it and what the economic impacts are. But just a little bit for me. Over to David now to do the real expert stuff.
Thanks very much, Tim. So I've got 6 things that were written down here. Probably haven't got enough time to cover them all, but just quickly going back to the question on local authorities, I agree entirely with what Beyza is saying. In the UK, however, budget cuts in local authorities here, with the move of public health teams, directors of public health from what were primary care trusts to local authorities, with the reforms back in 2012, those budgets were protected for public health for a period. I am told, and it is reported, that they have been reduced in some cases quite substantially, and that inevitably will impact upon local delivery of public health services in the community, if nowhere else. That's the first question. The point about equality, not directly tackling it, but when we planned for the influenza pandemic in 2009 and in the preceding period, one of the objectives was to try to identify a list of essential workers or so-called essential workers. That proved to be a huge challenge, trying to find out who is the obvious ones, if you like. You might have the emergency services and so on, but it doesn't take long before you get to realize that many of the jobs that people do that aren't in the public eye necessarily are absolutely essential. And it goes further than that in terms of support for the people that are considered to be delivering an essential role in society. So I think there ought to be much, much closer examination. Whether it will happen or not, who can tell? But there is another opportunity here that's created to look at the equality type issue. Mutations, I echo what Tim said. From what is being said, and it's really more in the evolutionary sense, the pressures are to make the virus less dangerous. This virus seems already to, from what we can tell, to be in a pretty good position in evolutionary terms, because it seems to be spreading very well. It's affecting a lot of people who are not very badly affected, and this is in the virus's interest, if the virus could conceivably have an interest, which of course it can't, not in this sense. Patricia's question about affecting children, this is another question that requires a lot of further investigation. It's not entirely clear whether children are not becoming infected or are not reacting to being infected in the same way that others and the more vulnerable parts of the population, the older part of the population, that they're reacting. There is already some discussion, as you would expect, around the way the body is reacting and the so-called immune response, which is in many cases causing a lot of the problems once people have become infected. So not the effect of the virus itself in causing pneumonia, which of course is a big issue, but it is about the immune response. And that might be one of the reasons why it's different in children and adults, but we don't know. Can you spread the virus if you're asymptomatic? These are all questions that are very good. We need to be much more informed about the virus as time goes on. The way it looks at the moment, it could be a route of transmission, but it's very difficult to say. So we are concerned at the large number of potentially mild cases and asymptomatic cases. If you remember when I started the presentation, the WHO recommendation was to avoid sick people, and that is on the basis of other droplet-borne infections where you can stay a metre or 2 meters away from somebody who's coughing or sneezing, and there are very obvious reasons why that's a way of social distancing and to an extent protecting yourself. If people are shedding the virus whilst they're asymptomatic, it creates a whole lot of other issues. But I am bound to say this is likely to be a relative risk issue, whatever happens in the end. And at the moment, we would say if you're coughing, that's when you're likely to be spreading the virus. I think that's probably all the questions I had down. So back to you, Laura.
Thanks. And I'm just going to look to the other panelists to see if anyone wants to make a final comment. No. And if anyone has a final question that's really urgent, then you can use the raise hand option, but I haven't seen any come up. In which case, a huge thanks to the panelists for joining and for agreeing to test this out. It's been fantastic to be able to hear from you all, despite us all being in different places. And yeah, I appreciate it. I think we all appreciate a bit of input from friendly but expert faces. Robin,
just
go.
one comment. I saw that we had up to 140 people on the call at the height or a bit over that at the height. So I just want to say a big thank you to all of our colleagues at Chatham House who tuned in today and engaged with the questions and so on. It's just a great, as Laura said, it's great for us to see each other, but because we're not seeing all of you at the moment. But you're all in our thoughts and we're all in each other's thoughts. So thank you very much indeed for participating. And well done, Laura, and the people behind the scenes, Robin, Gardner, and all the others who've been helping make this possible. And yeah, exactly. Melissa, the whole crew.
Brilliant, thank you. Keith is interested to hear how this was from an attendee perspective. So if you drop me or Keith or Stuart a line just saying whether it worked, what you think about the format, I think that'd be really helpful to all of us. Certainly in our programme, we've got a couple of conferences coming up that we're hoping to use this for, so be honest in your feedback. But thanks everyone, and stay healthy.